Hi, everybody. My name is Patrick Botts Forbes. I am the Community Emergency Response Team Central Bureau Coordinator for the City of Los Angeles. And I'd like to thank everybody for attending tonight. We are up to 95 attendees. This class builds on the previous ones. This is kind of a standard that I'm trying to build across the city, taking the basics from the CERT training, taking ICS classes, ICS 100, 200, 300, 400, 700, 800, pretty much the standard ICS classes, and the ideas that it instills, and applying it to CERT. What we've noticed in the new curriculum, the 2019 curriculum from FEMA, is that they've adjusted how they teach ICS. They kind of watered it down a bit. They did some good things, like they've removed the idea of the incident commander, because generally speaking, CERT is not going to be the incident commander. You're always going to have an agency that you're reporting to. So it's confusing if you're talking about being the incident commander and then that role transfers to another agency that takes over, and then who are you actually reporting to? Are you reporting to the same person that you were? You're reporting to a different incident commander. It confused things a lot, in my opinion. Unfortunately, what they've done is they've now called everybody a team leader. So pretty much anybody in a position of a role or somewhere in the hierarchy, the ICS chart, is a team leader. And that adds its own complication, because which team leader are you reporting to? ICS doesn't do that. ICS has specific roles. They have terms that are very specific. You do have leaders, but you also have supervisors as well. And each role in the ICS chart has its own title. And unfortunately, they've done us a bit of a disservice. So I'm trying to take what ICS teaches and apply that in something that's straightforward here, something that's easy for you guys to follow. This presentation is on leading medical response teams. Again, this is a progression of training. Starting with the last few trainings, we talked about CERT staging areas, we talked about leadership in general. This is more focused on the medical response team or incident response team. The reason why I'll jump between the two is CERT will be having a very medical heavy role, we expect, in a disaster. And we do encourage people to take medical training, first aid CPR, emergency medical responder, even EMT if you can, just so that you are brought up to speed and kept current on the standards. My name is Patrick Watts Forbes. I am the LAFD CERT Central Bureau Coordinator. I'm also a California EMT. During a disaster, the community emergency response team is going to really help their neighbors out by doing basic first aid. If you look at the statistics, 83% of LAFD calls in 2019 were medical related. 83%. That's not going to go away during a disaster. What we expect to happen is that, and statistically, most injuries during an earthquake occur minutes after the earthquake or about an hour later, and that's when the cleanup process begins. People are starting to clean up the rubble or debris, whatever happened, whatever fell, and that's when they become injured. We also fully expect that people will walk outside barefoot and step on broken glass or debris, and those injuries, especially a foot injury, if they are left untreated, can definitely become infected, and infections, especially of the feet, can become medical emergencies. In a previous presentation, someone commented that I'm calling people idiots when I say this. That's not the intent. The reality is most people, or a large amount of people in the state of California, in the LA basin, are not native Californians. They don't grow up with earthquakes. And so the first time you get a good jolt, or worse, the first time you're in something like Northridge, if you've never experienced this before, your brain shuts down and you revert to a instinctual mode. And that is, my entire house just shook, things fell down, and I don't know what's going on. I want to get outside of the building. I want to get to safety or where I think things are not going to fall on me. And if you're getting out of bed because this happened at 4 o'clock in the morning and you don't have the proper precautions, you don't have shoes available to you, and especially if you're panicking, your ability to reason, I need to put something on my feet to protect myself, is not there. And this is the whole point of the community emergency response team training, is to build these kinds of practices, build these kinds of thought processes, because it's not natural. It's not natural to think this way. And so when I say that people will walk outside barefoot and step on broken glass and debris, it's not because they're idiots. It's because that is simply what your mind is going to resort to if you've not experienced an earthquake before and you don't have the training. These are our neighbors. They're not idiots. They're our neighbors. They are our community members. They are people we want to help and need to help. And that's why you're in this class, to learn how to help your neighbors out. I hope that's clear. And I apologize if there was any confusion about that statement before. I'm a volunteer. I've taken these trainings and I'm putting together best practices. I'm putting together suggestions. This is not a certification class. This is not curriculum taught by FEMA or any of the universities or certification agencies out there. This is information that I hope will help you, but it is not hard and fast. It is not do this and this is the only way. These are things to get you thinking. And I think if you do follow this pattern, these ideas that I present, that you will do well in your response and organizing your teams. I teach that a team is made up of a core leadership element. At the very basic level, you have a 3-person team, a team leader, a scribe, and a radio communicator. That is your most basic element in a team. And when you first deploy out, if you just have 3 people, that is a solid team makeup. When you start building your response, you have more people coming to the staging area and being able to respond with you. You can add on pairs, and these are responder pairs. These are people who actually get their hands dirty and be able to do some good. That leadership element, that team leader, radio communicator, and scribe, they are mostly hands-off, and there's a reason for that, and I'll get into that next. When you're talking about responder pairs, especially in medical, I advocate for 1 person hands-on, 1 person hands-off, and I'll get into that as well. I want to talk about the leadership element here, and this was brought up when I asked someone to review these slides, that I should put them in priority, list these positions in priority, and my answer to that is I do. I actually consider the scribe, especially a medical response team, to be the most important position, more important than the radio communicator, more important than the team leader. And the reason for that is there's a saying in EMS, if it wasn't written down, it didn't happen. That scribe documenting things is going to save everybody's sanity. And the reason is, right after a disaster, everything is chaos. The idea of triage, the idea of response, is to put order to chaos. And the best way to do that is to write it down, document it. When you have an incident, having it written down, incident number, time, location, number of victims, severity, actions taken. This is going to be what you refer to constantly throughout the incident. And later on, when you're reviewing what happened, having a good scribe is going to make everybody's life easier. And I can tell you, if you're a team leader and no one is writing anything down, it is chaos. If you're a team leader with a great scribe that is documenting everything clean, neat, organized, it is so much better. And I can't really emphasize how much better that is, but they will make order of chaos for you. The radio communicator is going to be how you're going to communicate back to the staging area, how you're going to communicate with other teams and other response pairs. This is a vital position, and it's not really taught in the basic CERT training. It's not taught in Map Your Neighborhood so much. And the saying can be that radios fail, that technology fails. But with good radio communication, you can expand beyond what a runner can really relay information to. Without a good radio communication system, you're limited to a couple of blocks response. Realistically, where someone who can run and get help, someone who can run and say, this is an incident that we have to report in. You can't do that with a mile response radius, but with radios you can. If your radios can reach a mile out, that's your response radius. The team leader, and I list them last because the scribe and the radio communicator are doing work. When you talk about the response pairs, those people are doing work. The team leader's job is to ensure that all team members get home safely. That is a critical role. That is just as important, if not more important than the other two roles. But at the same time, the team leader shouldn't make the team. The team leader is there to keep the team safe. Additionally, the team leader sets the tone for the rest of the team. And so when you talk about now the response element, these pairs, these are working pairs, buddy teams. These are the core element of a CERT response. Remember, CERT training says you never do anything alone. You're always with a pair, a partner, a buddy, battle buddy, something like that. And the reason is team safety. We want to make sure that everybody gets home safely. We don't want to bring a victim to a disaster or to an incident. And what I'm teaching is that you should have one person hands-on, one person hands-off. The hands-on responder or rescuer makes primary contact with the victim or the survivor. In the 2019 curriculum, the word victim has been replaced with survivor because we're not working with victims, we're working with survivors of this disaster. So your hands-on rescuer is going to make contact with the survivor, they're going to assess, and they're going to treat. The hands-off responder is going to generally be the scribe. They're going to be documenting, but they're also going to be retrieving supplies for the hands-on responder, or they might be communicating on the radio. And the reason why this is so important is we actually had a drill where we did triage or treatment at the TARP, and we had moulaged victims. We had a bag of supplies, and we had the rescuers getting up and going, retrieving supplies from the bag, and then doing their treatments. When I went through the bag, I found moulage in the bag, and that meant that somebody got up with bloody gloves, realistically, reached into the bag and contaminated the bag. That second person can be the one who gets supplies out of the bag, keeps the bag sterile, keeps the bag from getting contaminated. And that's going to be critical. Making sure that your rescuer, your hands-on rescuer, is the person who can focus on treating without having to worry about what else that needs to be done. That second person, that hands-off responder, is there to help and make sure that happens cleanly. It's very critical that there's good intra-team communication. This will make or break a team. And at the very beginning, you want to establish everybody's role. I'm the team leader, you're the communicator, you're the scribe, you two are a buddy team that will be doing hands-on. You're going to be doing the hands-on portion, you're going to be scribing hands-off, and just establish those roles and get to know everybody. Get to know everybody's name. Get to know what they're comfortable doing, what kind of training they have. If you have an EMT with you, that person should probably be hands-on and not the radio operator, for example. But you won't know this, especially if you don't know these people, you haven't trained with them before, you won't know their level of training and what they're comfortable doing until you get to know them. And that's why that's so critical. You don't want to put someone in the wrong role. If someone is afraid of blood or passes out at the sight of blood, they probably shouldn't be the hands-on responder. When you're communicating, make sure you address people by their name. It builds that camaraderie, but it also makes sure that when you're addressing someone, they know you're addressing them. And they should in turn confirm the directions back to you and repeat whatever direction they were given. This makes sure that everybody's on the same page and make sure the person who received the direction understands it, that the person giving the direction understands that the person received it correctly, and then everyone else who's listening knows what those rules, what that direction is. Last thing, and this is probably the most important, everyone should be keeping a calm, even tone and pace. Definitely, people should not be yelling at each other. And we see these in drills all the time. It's stressful, people are not communicating properly, and that only ramps things up and people start yelling at each other. And it really breaks down the morale of a team and the camaraderie of a team as people are yelling back and forth and having ego fights between them. There's no place for an ego in CERT. We're all here to help each other out. We're all here to help our neighbors out. We're all here to work together for the common good. And so people yelling back and forth really breaks that down very rapidly. This is critical, especially in a medical situation. And EMS teaches this, EMTs teach standard precautions. This is across the board, EMS, medical, nursing, doctors, everybody learns this body substance isolation. And especially during a pandemic situation, these rules are standard. These are universal. This is what we all learn, and it applies across the board for almost every situation. There are things that go above and beyond this, but this is the base layer. Wear medical gloves before you touch anybody, regardless if they're bleeding or not. Before you even touch someone who looks perfectly fine and you just want to check them for any injuries, make sure you have gloves on. And they should be non-latex. The reason is that people develop a latex allergy, and it's fairly common. There are other kinds of allergies. Nitrile allergies do exist, but for by and large, if you can get nitrile gloves, those are the preferred ones to use. Make sure they're medical grade. Don't buy kitchen gloves and use that to do treatment on someone. You want to wear a procedural or surgical mask, or especially during an earthquake, we should be wearing N95 masks. There will be debris in the air. There will be dust. And anyone who's in LA City right now knows that it's smoke everywhere. In fact, we were talking about it earlier, the smoke has gone across the entire country. People on the East Coast are now reporting the smoke has reached them from the West Coast. And that should tell you a lot. The N95 mask is not only going to protect you, but it's going to protect other people if you don't have the vent. There's two kinds of N95 masks. One has a vent on it that helps you breathe out easier. Those are for construction. Those are for people who are working and need to have not around other people. The N95 masks that are used for medical don't have a vent. And the reason is the vent does not filter the air. So as you breathe out through an N95 mask with a vent, the outflow air is unfiltered. The N95 mask with no vent filter both ways. And in general, that's what we should have in our bags. And especially during a pandemic situation like we have right now, that's the mask you want to be wearing when you come in contact with other people. Additional safety precautions, goggles, safety glasses, or face shields. These are good to protect yourself from other people or dust in the air, debris in the air, things that can hurt your eyes. If you get dust in your eye and you don't have a way to get it out, or you get something, debris of some sort in your eye, you could actually get sidelined pretty quickly. So I can't stress how important that is to have those goggles and safety glasses. And when you're working on anybody who's treating a patient, those safety goggles, those glasses are going to protect you as well, because the eyes are a definite avenue into the body for pathogens. Everyone must wear closed-toed shoes. Everyone should be wearing long pants. I can't tell you how many people show up at a drill wearing shorts and flip-flops, they will be sent home, or they will be put into a position where they're not going out in the field because it's too easy to get your feet cut up or your legs cut up, especially in a disaster scenario. When you're wearing gloves, make sure you change them between patients and before you reach supplies. It's a good idea to double glove. That way you have one pair on to protect you and the top layer to protect whoever you're working on. When you're done working on one person, remove that top layer, leave the bottom layer on, put on another glove, and then go to work on the next patient. The team leader needs to remain hands-off. What we've seen in the past at drills is that the team leader, whose duty really is to keep everybody safe, they want to be the one who jumps in. They want to be gung-ho. They think they have the most amount of experience and want to help the most. But when they're hands-on, when they're focused on a patient, when they're focused on anything and not team safety, that team safety element disappears. They're not protecting the team. They're not keeping situational awareness. They're not seeing the other team approach that has no idea what's going on. And everything about that team just fails at that point. So in order for it to be an effective team leader, you must be hands-off. As soon as you go hands-on, you're no longer the team leader. In a medical response team, the team leader doesn't even need to be medically trained. It can be very helpful if they are. They should at least have an idea of what's going on, but because that element there is to make sure that everybody gets home safely, and they're not going to be hands-on, they're not going to be working on patients, there is no requirement to be medically trained. An EMT who's a team leader can help other first aiders do more than if that EMT is working on one patient. If you're working on one victim or survivor, you're working on that one person. But as a team leader, you can provide advice to your team members and help more people by being a team leader. So it's really a position of comfort. What do you want to do? Where do you think you're going to be most helpful? But I don't want people to think that you have to be medically trained in order to be that team leader. The team leader sets the energy level and the tone of the team. I mentioned this earlier. If you are anxious, nervous, jittery, you don't feel confident in yourself, the entire team will sense this and they will inherit this emotion, this nervousness, this jitteriness that you have, and the team will be less for it. But if you're calm, if you're collected, you're speaking with an even tone, you're not yelling, you sound like you've got everything together and you're in charge, even if you're not, but that's the way you project it, the entire team will inherit that. They will be calm. They will be collected. They know they're in good hands. The team leader is setting the tone for the entire thing. And I mentioned you don't actually need to be. It's the first time you're the team leader, you're panicking on the inside. But if you can hold it together and show that and fake it till you make it, the rest of the team won't know that you're panicking. The team leader's primary job is to ensure that the team makes it home safely. Even if you can't accomplish the mission, you can't do what you were supposed to do because something has come up that puts the team at risk, you make sure the team home gets safely. You've accomplished your task. You've accomplished your job as the team leader. That's hard to say, you know, oh, we couldn't make it to this incident where people died because something came up and the entire team was at risk. But we made this decision to come back to the staging area and not put the team at risk. You're going to be working with the CERT staging area to make decisions. There's going to be a lot of scenarios, a lot of incidents out there where it's not 100% up to you what you do. You have this group you're working with. They're the ones who are in charge to make sure that the team is safe just as much as the team leader is. So work with your staging area, let them know what's going on, and come to the decision together. The radio communicator is not a passive position. We see this a lot of times in the drills where the radio communicator is waiting for the team leader to tell them what to say to the staging area. The radio communicator should be providing location updates, situational awareness updates, and incident updates to the staging area without being told this. They shouldn't wait for the team leader to say, that car wreck up there with a body laying out through the window, we should call this in and let the staging area know that this has occurred. No, as soon as you see this, let the staging area know we have an incident, this is the location, this is what we're seeing, we're going to get back to you with more information. If that car explodes and takes out the team, if you've gotten that information out to the staging area, they at least know where to find you. But if you walk up and then the team leader says, oh, by the way, we should call this, and the explosion occurs, no one's coming to help. No one knows where you are. When you're radioing, I like to call this the 5 Ws. And if you follow this pattern, I think you're going to be very successful in how you communicate. First W, who are you trying to reach? Second W, who are you? Third W, where are you? If that's the first part of your radio transmission and your radio drops dead at that point, the staging area who you're calling, you're telling them that you're medical response team 1 and you're at this location, and then your radio dies. They know how to find you. Second part of this is, what do you have and what do you need? And this is a little more flexible because you might not need something, you're providing an update. But if you can formulate these questions and jot them down in your notes and then read them off in bullet points, you're going to be successful in your radio communication. The scribe's actually a very active role. A lot of people think that it's not important or it's a lesser role. And I stressed earlier, I think the scribe is the most important position in a medical response team. If it wasn't written down, it didn't happen. The scribe should not be waiting to be told what to write down. They should be documenting everything. They should know what they need to be documenting. They should be anticipating what needs to be documented. And there are CERT forms that make this easy. You already have listed out in a chart what you should be documenting. Location. Where did this occur? Where is this incident? When you're anticipating that this is going to get reported in. So when you're documenting, the staging area needs to know when you triage, how many survivors do you have, their gender, approximate age, and this is less for the staging area, less to be radioed in, but this will come up later, their chief complaint. So if at the very least you document that you have 5 survivors, 3 immediate, a 35-year-old female, 20-year-old male, 15-year-old female, 2 delayed, a 40-year-old male, 5-year-old female. That's the basis of all the good documentation that you're going to need to do. Everything's going to build from there. You can then add into your documentation that the 35-year-old female, and we're focusing on the immediates here, 35-year-old female is breathing rapidly, the 20-year-old male is unconscious, the 15-year-old female has a severe upper thigh laceration, and a tourniquet was applied. This is going to be referenced later. And if you have this information documented already, and it's natural that you're going to be doing this, you're going to be much more valuable, or your information is going to become very valuable to whoever is asking for this information. I think I bring this up later in another slide, but it's important that you seek out this information. Don't wait for it to be given to you if you're the scribe. Don't wait to be told what to write down. Ask these questions. Even if it's in your own mind. Okay, where are we? How many survivors do we have? And what are their genders, age, and chief complaints? The scribe should be working very closely with the radio operator. They're the first pair, the first buddy team. And the information that you document as a scribe is going to be used by the radio operator. If you're jotting down the notes anticipating those 5 Ws for the radio operator, and the radio operator starts to report in, you turn your clipboard to them and you've got them jotted down, you're going to make the radio operator's job so much easier. Who are you trying to reach? Who are you? Where are you? It's actually kind of surprising that, especially since we don't do this every day, you might not remember as the radio operator what your team name is. Maybe you don't know where you are. or who you're trying to reach, but you read it off the clipboard of the Scribe. It says CERT staging area. This is medical response team 1. We're at the corner of Walk and Don't Walk. We have 5 victims, 3 immediate, 35-year-old female, 20-year-old male, 15-year-old female, 2 delayed, 40-year-old male, 5-year-old female. What do you need? We're going to continue assessing them, we'll get back to you. Or we need to extract them and have them transported to definitive care. That second part is going to be completely situational dependent, but that kind of information is going to help that radio communication go smoothly. After you have that core team, that team leader, that radio operator, and the Scribe, built onto that is now the response portion of this. Your first aid responder is a responder pair, and again, one is going to be the rescuer who's hands-on. That person should be double gloving. They're going to be touching survivors. They want to make sure they're protecting themselves and protecting the other survivors. As soon as they're done assessing or treating, they're going to take that top layer off and then put on another layer of gloves and move on to the next one. When you approach, you should introduce yourself. Inform them that you're a community emergency response team member. Generally speaking, if they're in a trauma, they don't know what's going on, that by you telling them who you are, and don't use the word CERT. Nobody knows what the word CERT is except for other CERT members. If you tell them you're a community emergency response team member, that is self-explanatory. They're probably just going to hear emergency response, and that's all they care about. They know you're there to help them. That's going to immediately put them at ease. If you just walk up and you start touching them, you don't ask for permission, you don't tell them who you are, that is assault. They might be begging for help, but by just introducing yourself and telling them who you are, you're going to start to build that ease into the situation that they have. Next thing, ask them for their name. You want to get to know them, at least let them think that you're getting to know them and you're there for them. You might have 15 other victims and you're not going to remember their name 30 seconds after you ask for it. Maybe even not even 15 seconds asked. But the fact that you ask for their name to them means that you're taking care of them now. They know you're there to help them. Extend your hand. Most people will instinctively respond by reaching back out and shaking your hand. If they do this, you now know that they can follow simple directions. And this goes to how we triage in the next slide. Then ask if you can help them. Where does it hurt? What happened? Unless you're dealing with 60 victims and you're the only one there who's triaging, just take a little bit longer to add these niceties. If they answer verbally, that tells you that they're breathing. If they answer you coherently, that tells you about their mental state. The Scribe or the hands-off person, the assistant, they should also be wearing gloves. Just in case, they should try and avoid going hands-on, but there will be situations where you're going to have to step in as the Scribe and get your hands bloody. That's why you're wearing the gloves. If you want a double glove, great, but you have those gloves on just in case. You're documenting, and if you don't get the information you need to ask for it. Be proactive in your seeking of information. What time is it? Where are you? What's the name of the survivor you're working on or your team is working on? Document their responses to questions. Document any information that your rescuer gives you about what they're finding when they're doing their assessments. And hand the rescuer supplies in the bag. Do not let your rescuer reach into the bag. In fact, it's probably best that your rescuer doesn't have a bag. You have the bag, you have the supplies, you hand it to them. That keeps the bag safe from any contamination. And I will tell you, if you are a rescuer and you have someone who's bleeding out, you're focused on that. You're focused on stopping that bleeding. You're focused on keeping this person alive. Everything else goes to the wayside. And that puts the team at risk. That puts other people at risk. So as that second person there, the hands-off person, you're there to keep that rescuer from doing something inappropriate. You're there to provide them what they need to get the job done and let them focus on that. With that said, sometimes your rescuer will forget to change gloves, especially if they're moving to the next patient. They have 15 survivors in front of them. They're going to be leapfrogging and they're going to be trying to get this done as quickly as possible. Remind them to change their gloves between each survivor. Now, if you have 15 survivors and you have, 5 pairs of gloves, you're going to do what you can do with what you have. Do the best you can do. The priority for the team is a medical response team, incident response team. You're going to triage, stabilize, treat, and prepare for transport. What you're going to be doing is you're going to be visually assessing each survivor as you approach them. Build an initial impression. This person looks effed up. This person is not breathing right. This person is pale. This person is missing a limb. That starts your mind on what you need to do. What are your priorities when you assess this person? Assess them for immediate life threats. I'll tell you what the acronym MARCH stands for in the next slide, or RPM. Treat, stabilize any life-threatening injuries. So you're going to, if you see someone's bleeding out through a femoral bleed, you're going to put a tourniquet on that. Stop that bleed from killing that person. If they are not breathing, you're going to try and open their airway, get them to breathe. If they don't have a heart, if they're not breathing, they don't have a heartbeat, and there's 15 other victims, you're going to move on because at that point they're not alive, unfortunately. Assess after you treat any life-threatening injuries, then you're going to assess for anything else. And this is more of the stage at which you've stabilized everybody, you've triaged everybody. Now you're going to go back. You're going to do the head to toe on everybody. Find anything that you missed during your life-threatening injury assessment. And continue reassessing for any new life threats or changes. People who have been injured severely, they will start to go downhill. They might be stable right now, or they might be not dying right now, but in 5 minutes, they can start to go downhill pretty quickly. So you need to keep that reassessment going. Always reassess. And think about this question, how is this survivor leaving your care? Are you going to have a rescue ambulance from the fire department show up? Are you going to take this person to a treatment area? Are you going to put this person in the back of a flatbed truck and take them to the hospital? These are the important things you need to think about when you're treating these people, survivors of a disaster.